Terry and Susan are both certified hyperbaric technicians, and they are the co-owners of All Creatures Hyperbaric Care. Their relentless ambition and passion for animals has been the crux of their success. Their company has developed HBO2Go, a mobile climate-controlled hyperbaric unit available to veterinarians in the Central Texas area. HBO2Go travels to clinics and even to patient homes to perform treatments. Their clients have described these two ladies as excellent leaders, honest and dedicated individuals, and true lovers of animals. Good. Hello, Terry. Hello, Susan. Thank you so much for joining us on the Wound Wire.
Thank you so much for having us.
Well, listen, let's start off by allowing you to tell us just a little bit about your company, All Creatures Hyperbaric Care. What do you do? What is this all about? What kind of conditions do you treat? Tell us a little bit about the company.
We treat underneath veterinarians. We're on call in emergency 24-hour, 7 days a week. It seems our niche right now seems to be emergency medicine. We've worked anywhere from snake bites to wounds as an additional therapy for the veterinarians.
So a veterinary physician will have an emergency. For example, you mentioned snake bite. A snake bite in what type of animal?
It's been mostly dog.
Dog bites. And so they would then page you, call you, and you'd respond to that emergency. Would you bring the chamber to the site, or does the animal come to you, or is it both?
Most of them are in ICU conditions, so we take HBOT to go to the emergency clinics.
So give us a typical scenario. How many treatments would the patients, the animals, be required in this sort of setting?
Some of our emergency medicine has only been 3 treatments on some of the animals, some of the brain trauma, some of the birth asphyxia. We've only treated the animals like 3 times. Some of the animals we've had to treat 10 to 14 times.
Okay, very good. So there's a variety of conditions that you treat. You mentioned the emergency traumatic snake bites. I heard asphyxia, birth asphyxia. Tell us some of the other types of patients that you treat.
Well, we treated everything from rats, prairie dogs, baby deer, cats, dogs, baby horses. You mentioned the calf. Oh, and the calf. We just a wide variety. We were approved last month to do continuing education for veterinarians on safety and hyperbaric medicine by the Texas Vet Medical Board. So we hope that that's going to give us a bigger range of animals to treat and use the whole indication list that we have with veterinary hyperbarics.
Oh, that's very interesting. Why don't you share with the audience your most memorable patient treatment or outcome, or which one really comes to mind when you think of everything that you've treated?
We were called on an emergency, a veterinarian that we had not worked for, that had a 4-month-old oldie bulldog, which we know they don't breathe very well anyway because of their short noses. We were called in. The owner suggested that they try hyperbaric medicine for her. She was given a 10% chance of survival. She had chewed through an electrical cord and had burns into her lungs. She was basically drowning. After the first treatment, as soon as we put her in the chamber, like within 10 or 15 minutes, you could see that she wasn't struggling to breathe. And that's all she was doing at the time we got there. We can be on site and treating an animal in 20 minutes. So we did one treatment on her, and I told the vet, I said, she needs a treatment tonight. And he said, I'll have to work at an emergency clinic in some other town. I said, then take her with you. I will meet you there. And so I drove the chamber over to another town and parked outside their emergency clinic there, and we treated her, and it was amazing. She was a different dog, and then the next morning the owner met us at the normal veterinary clinic where she mostly took her animals, and Ming Ming was bouncing around. We put her in the chamber and did a treatment on her and did a video, and the owner was just in tears, and she said, "I can't believe we saved this dog." And that's one of the studies that we submitted to the Veterinary Hyperbaric Medicine Society for an approval on. We did 3 x-rays in 36 hours, and you just couldn't believe the condition of her lungs from one to the last one.
Those are some amazing stories. You mentioned the Veterinary Hyperbaric Society. Where is that based, and how long has it been around? Tell us a little bit about that society.
University of Tennessee. I believe 2 years. They're working towards having certified veterinary medical hyperbaric technicians. That's not in place yet, but that's one of the things we see as a bright future for veterinary hyperbarics.
So just some amazing stories, some amazing outcomes. Congratulations to both of you. What's the future for All Creatures Hyperbaric? Do you see a franchise in your future? Do you see this? Do you see growth for a company like your own?
Oh yeah, it's astronomical, the amount of growth in human medicine. As you know, you have about 7,500 hospitals, and you have 12% hyperbaric chambers available in those. In veterinary medicine, there's over 25,000 veterinary clinics and hospitals, and they right now only have a 2% availability to hyperbaric medicine for their clients.
Oh, wow. Well, listen, again, thank you so much for sharing your story. Fascinating area of a topic for hyperbaric medicine. If people were interested in contacting you for more information, or if they had an emergency and needed your care, where would they go for more information?
Our website, or and pick up our phone numbers. Both of us answer the phones 24/7.
Great. Well, we'll put that website up and the phone number up for the viewers. Again, thank you so much for joining us from Texas, and continued success to both of you. I'm very impressed with your passion and your desire to help patients with hyperbaric medicine. Thank you so much.
Thank you very much. Thank you.
And we'll be right back.